1. What is the primary factor influencing clinical judgment in nursing practice? A. Personal bias. B. Patient's clinical presentation. C. Availability of technology. D. Nurse's years of experience. Answer. Patient's clinical presentation. Rationale. Clinical judgment is primarily influenced by the patient's clinical presentation, including symptoms, vital signs, and medical history. While experience and technology play important roles, they should be used to support judgment, not replace patient assessment. Personal bias should be minimized in clinical decisions. 2. Which of the following is the most critical step in clinical decision-making during patient assessment? A. Checking the patient's medical records. B. Listening to the patient's concerns. C. Performing a thorough physical examination. D. Reviewing lab results. Answer. B. Listening to the patient's concerns. Rationale. Listening to the patient's concerns is crucial as it helps form a holistic understanding of their condition. It provides insight into symptoms, expectations, and potential issues not yet identified through physical assessments or lab results. While the other options are important, they should supplement, not replace, effective communication. 3. Which clinical scenario requires immediate intervention based on prioritization? A. A stable patient requesting pain medication. B. A patient with severe chest pain and shortness of breath. C. A patient requesting discharge papers. D. A patient exhibiting mild fatigue after a procedure. Answer. B. A patient with severe chest pain and shortness of breath. Rationale. Severe chest pain and shortness of breath are potential signs of a life-threatening condition such as a heart attack, requiring immediate intervention. While other scenarios require attention, they are not as urgent in comparison. Prioritizing life-threatening symptoms is crucial in nursing practice. 4. When a nurse delegates a task, which factors should be considered first to ensure proper clinical judgment? A. The task's complexity. B. The nurse's workload. C. The team member's skill level. D. The patient's preference. Answer. C. The team member's skill level. Rationale. Delegation is guided by the team member's skill level, ensuring they are capable of safely and effectively performing the task. While the task's complexity and the nurse's workload are important, the main concern is whether the delegatee has the appropriate skills. Patient preference, though relevant, is secondary in this decision. 5. Which ethical consideration is most important when making clinical judgments for a patient who is unable to make decisions for themselves? A. Providing care based on the nurse's personal values. B. Seeking input from family members and other healthcare professionals. C. Following the physician's orders without question. D. Making decisions based on hospital policy. Answer. B. Seeking input from family members and other healthcare professionals. Rationale. When a patient cannot make decisions, it is important to involve family members and other healthcare professionals to ensure that the patient's wishes are respected and that decisions align with the best possible care. Personal values should not dictate care, and hospital policies should be followed in context, not in isolation. 6. Which of the following actions would best demonstrate clinical judgment when responding to a deteriorating patient? A. Waiting for the physician to assess the patient. B. Taking immediate action based on the nurse's assessment. C. Administering prescribed medication without reassessing. D. Informing the patient's family and waiting for their approval. Answer. B. Taking immediate action based on the nurse's assessment. Rationale. In situations where a patient's condition is deteriorating, the nurse must act immediately based on their assessment and knowledge to stabilize the patient. Waiting for the physician or family approval could delay critical interventions. 7. When a nurse encounters a patient exhibiting early signs of shock, what is the first action the nurse should take? A. Administer prescribed fluids. B. Check the patient's vital signs. C. Call the physician. D. Raise the patient's legs. Answer. B. Check the patient's vital signs. Rationale. The first step is to assess the patient's vital signs to determine the severity of shock and guide subsequent actions. While fluid administration and raising the legs may help in certain situations, a thorough assessment should precede these interventions. 8. Which factor is the most critical in determining a nursing intervention for a patient with diabetes who is experiencing hyperglycemia? A. The patient's blood glucose level. B. The patient's age. C. The patient's previous medical history. D. The patient's emotional state. Answer: A. The patient's blood glucose level. Rationale: the patient's blood glucose level is the most important factor in determining appropriate intervention for hyperglycemia. While other factors like medical history and age may influence treatment, the immediate focus is on addressing the glucose level. 9. In a situation where two patients have competing needs, which nursing action best demonstrates clinical judgment? A. Treating both patients simultaneously without prioritization. B. Prioritizing the patient with the most severe condition. C. Asking for help from other staff members to manage both patients. D. Waiting for physician orders before taking any action. Answer: B. Prioritizing the patient with the most severe condition. Rationale: prioritization is key in nursing practice. The nurse should focus on the patient with the most critical condition to prevent further deterioration. While seeking help is important, it should be done after addressing the immediate needs of the most severe patient. 10. Which of the following strategies demonstrates clinical judgment in managing a patient with a history of hypertension? A. Monitoring blood pressure frequently. B. Administering medications without reassessment. C. Avoiding communication with the patient about their condition. D. Reducing the patient's fluid intake without consulting a physician. Answer: A. Monitoring blood pressure frequently. Rationale: frequent monitoring of blood pressure is necessary to assess the effectiveness of treatment and detect any changes in the patient's condition. Administering medication without reassessment could lead to adverse outcomes, and reducing fluid intake without a physician's approval is inappropriate. 11. When assessing a patient with a suspected stroke, what should the nurse prioritize first? A. Obtaining the patient's medical history. B. Performing a neurological assessment. C. Asking the family for symptoms. D. Administering prescribed medication. Answer: B. Performing a neurological assessment. Rationale: the nurse must prioritize performing a neurological assessment to assess the patient's condition and identify the signs of stroke. Early intervention is crucial to prevent further damage. 12. Which of the following interventions reflects clinical judgment when a patient is experiencing shortness of breath? A. Administering oxygen as prescribed. B. Checking vital signs before taking any action. C. Reassuring the patient and delaying action. D. Ignoring the symptom if the patient appears stable. Answer: A. Administering oxygen as prescribed. Rationale: administering oxygen is a timely and appropriate intervention for shortness of breath. While vital signs are important to check, waiting for them before initiating treatment could delay care. Reassurance or ignoring the symptom can be harmful. 13. What is the most important consideration when deciding whether to delegate a task to a nursing assistant? A. The task's complexity and whether the assistant is capable. B. The nurse's workload. C. The assistant's desire to perform the task. D. The patient's satisfaction with the task performed. Answer: A. The task's complexity and whether the assistant is capable. Rationale: delegation should be based on the complexity of the task and whether the nursing assistant has the proper skills to complete it safely. The nurse's workload and patient satisfaction are secondary considerations. 14. Which of the following is the most appropriate action for a nurse managing a patient with acute pain following surgery? A. Administering pain medication as prescribed. B. Delaying pain medication to assess for side effects. C. Providing comfort measures only without medication. D. Ignoring the patient's request for pain relief. Answer: A. Administering pain medication as prescribed. Rationale: the priority in managing postoperative pain is to administer prescribed pain medication to alleviate discomfort. Delaying treatment could lead to unnecessary suffering, and comfort measures alone may not be enough. 15. In a situation where a patient is confused and unable to communicate their needs, what is the first action the nurse should take? A. Provide reassurance and leave the patient alone. B. Assess the patient's environment for potential hazards. C. Wait for the physician's assessment. D. Ignore the confusion and focus on other tasks. Answer: B. Assess the patient's environment for potential hazards. Rationale: The nurse should first assess the environment to ensure there are no hazards that could cause harm. Confusion in a patient often requires immediate attention to their safety before any further assessments or interventions. 16. When managing a patient with chronic pain, which approach best demonstrates clinical judgment? A. Focusing on pharmacological interventions only. B. Incorporating both pharmacological and non-pharmacological interventions. C. Ignoring the patient's pain as they should be used to it. D. Delaying treatment until the pain becomes unbearable. Answer. B. Incorporating both pharmacological and non-pharmacological interventions. Rationale. A holistic approach to managing chronic pain involves both pharmacological and non-pharmacological interventions, such as physical therapy or cognitive behavioral techniques. Focusing only on medication may not address all aspects of the patient's pain experience. 17. How should a nurse demonstrate clinical judgment when dealing with a patient with conflicting family members' opinions on care decisions? A. Make the decision independently, without consulting the family. B. Involve a multidisciplinary team to facilitate communication. C. Follow the opinion of the most senior family member. D. Ignore family input and focus solely on medical considerations. Answer. B. Involve a multidisciplinary team to facilitate communication. Rationale. In situations where there are conflicting opinions, involving a multidisciplinary team, including social workers or ethics committees, can help mediate and make a balanced decision while ensuring the patient's best interests are met. 18. What is the most appropriate response when a nurse suspects that a patient is at risk for developing an infection? A. Wait for the physician's orders to implement any interventions. B. Implement infection control protocols immediately. C. Ignore the suspicion and monitor the patient. D. Administer antibiotics without confirmation. Answer. B. Implement infection control protocols immediately. Rationale. Infection control protocols should be implemented immediately to prevent the spread of infection. Waiting for physician orders could delay necessary interventions, and administering antibiotics without confirmation is inappropriate. 19. Which action best demonstrates clinical judgment when a nurse identifies that a patient is at risk for falls? A. Administering medications to sedate the patient. B. Documenting the fall risk and continuing regular care. C. Implementing fall prevention strategies, such as using assistive devices. D. Ignoring the risk if the patient appears stable. Answer. C. Implementing fall prevention strategies, such as using assistive devices. Rationale. Implementing fall prevention strategies is essential in reducing the risk of falls. These strategies include the use of assistive devices, proper room setup, and monitoring. Simply documenting the risk without intervention does not mitigate the hazard. 20. When a nurse is assessing a patient with a history of alcohol abuse, what is the most important consideration? A. The patient's current blood alcohol level. B. The patient's medical history and withdrawal symptoms. C. The patient's willingness to seek treatment. D. The nurse's personal feelings about alcohol abuse. Answer. B. The patient's medical history and withdrawal symptoms. Rationale. A thorough understanding of the patient's medical history, including withdrawal symptoms, is crucial to assessing their condition and providing appropriate care. The current blood alcohol level and treatment willingness are important, but secondary considerations. 21. Which of the following demonstrates the nurse's ability to make clinical judgments when managing a patient with acute pain? A. Waiting for the physician to assess the pain level. B. Administering pain medication as soon as possible. C. Ignoring the pain and continuing with other assessments. D. Reassessing pain after medication administration and evaluating effectiveness. Answer. D. Reassessing pain after medication administration and evaluating effectiveness. Rationale. Reassessing the patient's pain level after administering medication helps determine the effectiveness of treatment and ensures proper pain management. Waiting for a physician's assessment or ignoring the pain delays necessary care. 22. What is the nurse's role in responding to a deteriorating patient's respiratory status? A. Notifying the physician before taking any action. B. Providing oxygen and monitoring the patient's oxygen saturation. C. Ignoring early signs and monitoring closely. D. Giving pain medication to relax the patient. Answer. B. It's providing oxygen and monitoring the patient's oxygen saturation. Rationale. The nurse must promptly provide oxygen and monitor oxygen saturation to ensure the patient's respiratory status improves. Delaying action or focusing solely on pain relief could worsen the situation. 23. What should the nurse do first when assessing a patient with a suspected gastrointestinal bleed? A. Administer fluids as prescribed. B. Check vital signs for signs of shock. C. Notify the family about the patient's condition. D. Document findings before taking further action. Answer. B. Check vital signs for signs of shock. Rationale. Assessing vital signs is critical to identifying signs of shock, which may indicate the severity of the gastrointestinal bleed. Fluids and other interventions should follow after an initial assessment. 24. In a situation where a nurse is unsure about a medication order, what should the nurse do first? A. Administer the medication as ordered. B. Verify the order with a physician or pharmacist. C. Wait for a second opinion from another nurse. D. Document the medication administration without clarification. Answer. B. Verify the order with the physician or pharmacist. Rationale. The nurse should always verify any unclear medication orders to prevent errors and ensure patient safety. Waiting for second opinions or administering the medication without clarification could compromise the patient's health. 25. Which of the following actions best demonstrates the nurse's clinical judgment in managing a patient with a history of substance abuse? A. Assuming the patient is exaggerating their symptoms. B. Is providing non-judgmental care and assessing withdrawal symptoms. C. Ignoring withdrawal symptoms if the patient is stable. D. Giving the patient sedatives to ease symptoms. Answer. B. It's providing non-judgmental care and assessing withdrawal symptoms. Rationale. Nurses should provide non-judgmental care, assess for withdrawal symptoms, and intervene appropriately to prevent complications. Assuming symptoms are exaggerated or ignoring the withdrawal symptoms can harm the patient. 26. When dealing with a post-operative patient showing signs of infection, what is the first nursing action? A. Administering antibiotics as prescribed. B. Taking a culture of the wound site for laboratory analysis. C. Notifying the physician about the infection. D. Monitoring the vital signs to assess the severity of infection. Answer. D. Monitoring the vital signs to assess the severity of infection. Rationale. Monitoring vital signs helps assess the severity of the infection and determines the urgency of interventions. Afterward, notifying the physician and taking cultures can guide further management. 27. In assessing a patient with severe anxiety, what should the nurse prioritize first? A. Administering anxiety medication. B. Providing a quiet and calm environment. C. Talking to the patient about the underlying cause of anxiety. D. Ignoring the patient's emotional state and focusing on physical health. Answer. B. Providing a quiet and calm environment. Rationale. A quiet and calm environment is essential in reducing anxiety and calming the patient. Administering medication or addressing the underlying cause can follow after addressing the immediate emotional distress. 28. Which action best reflects clinical judgment when caring for a patient with dehydration and low blood pressure? A. Administering 4 fluids as prescribed and monitoring blood pressure. B. Asking the physician for additional orders before administering fluids. C. Restricting fluid intake to prevent complications. D. Ignoring the low blood pressure as a temporary condition. Answer. A. Administering 4 fluids as prescribed and monitoring blood pressure. Rationale. Administering fluids and monitoring blood pressure is essential for addressing dehydration and low blood pressure. Waiting for additional orders or restricting fluids would delay essential care. 29. When caring for a patient experiencing chest pain, which action should the nurse take first? A. Administer pain medication immediately. B. Assess the patient's vital signs and ECG for abnormalities. C. Call the physician and wait for further instructions. D. Provide reassurance and delay medical intervention. Answer. B. Assess the patient's vital signs and ECG for abnormalities. Rationale. Early assessment of vital signs and ECG is critical for diagnosing the cause of chest pain and determining the urgency of the situation. Administering medication or waiting without assessment can delay important interventions. 30. What is the nurse's primary responsibility when a patient is experiencing an allergic reaction to a medication? A. Documenting the reaction in the patient's chart. B. Notifying the physician and discontinuing the medication. C. Administering an antidote immediately. D. Reassuring the patient that the reaction will subside. Answer: B. Notifying the physician and discontinuing the medication. Rationale: the nurse's primary responsibility is to notify the physician immediately and discontinue the medication to prevent further harm. Administering an antidote or reassuring the patient without proper action could worsen the reaction. 31. In a patient with a suspected myocardial infarction, what should the nurse do first? A. Administer morphine for pain relief. B. Obtain an ECG to confirm the diagnosis. C. Provide reassurance and avoid taking immediate action. D. Notify the physician about the possible myocardial infarction. Answer: B. Obtain an ECG to confirm the diagnosis. Rationale: obtaining an ECG is critical to confirm the diagnosis of myocardial infarction and determine the appropriate treatment. Administering medication or simply notifying the physician without confirmation may delay life-saving interventions. 32. What is the nurse's priority when managing a patient who is at risk for falls? A. Is offering reassurance that falls are unlikely. B. Implementing fall precautions, such as using non-slip socks and a call bell. C. Ignoring the risk and focusing on other aspects of care. D. Restricting the patient to bed without considering mobility needs. Answer: B. Implementing fall precautions, such as using non-slip socks and a call bell. Rationale: the nurse should implement fall prevention strategies, such as using non-slip socks and ensuring the patient has access to a call bell to request help. Ignoring the risk or overly restricting the patient can increase the likelihood of harm. 33. When responding to a patient in severe pain after surgery, which action best demonstrates clinical judgment? A. Giving a placebo instead of prescribed pain medication. B. Offering reassurance and avoiding medication administration. C. Administering pain medication and reassessing pain levels afterward. D. Ignoring the pain and focusing on other care needs. Answer: C. Administering pain medication and reassessing pain levels afterward. Rationale: proper pain management involves administering prescribed medication and reassessing the patient's pain to ensure relief. Giving a placebo or avoiding medication can cause unnecessary suffering. 34. In managing a patient with asthma exacerbation, what is the first nursing intervention? A. Administer prescribed bronchodilators. B. Reassure the patient and allow time for the medication to work. C. Monitor vital signs and oxygen saturation levels. D. Administer antibiotics as prescribed. Answer: A. Administer prescribed bronchodilators. Rationale: administering prescribed bronchodilators is the first step in managing an asthma exacerbation to relieve bronchoconstriction. Monitoring vital signs follows after administering medication, while antibiotics are not typically needed unless there is an infection. 35. What is the first action a nurse should take when caring for a patient with a head injury and decreasing level of consciousness? A. Administering pain medications as prescribed. B. Ensuring the patient's airway is clear and providing oxygen if needed. C. Waiting for the physician's orders. D. Monitoring the patient's blood pressure and heart rate. Answer: B. Ensuring the patient's airway is clear and providing oxygen if needed. Rationale: ensuring the patient's airway is clear and providing oxygen are priority interventions to maintain oxygenation and prevent further neurological damage. Monitoring vital signs is also essential, but should follow airway management. 36. Which of the following actions reflects clinical judgment when assessing a patient who has just received a blood transfusion and is experiencing chills? A. Administering acetaminophen to reduce fever. B. Discontinuing the transfusion and notifying the physician. C. Ignoring the chills if the patient is otherwise stable. D. Waiting for the transfusion to be completed before taking action. Answer: B. Discontinuing the transfusion and notifying the physician. Rationale: chills during a blood transfusion may indicate a reaction, and the transfusion should be stopped immediately. Notifying the physician is necessary for further management, and delaying action could worsen the situation. 37. What is the nurse's primary action when a patient exhibits signs of an allergic reaction to a medication? A. Discontinue the medication and notify the physician immediately. B. Document the reaction and continue the medication. C. Provide reassurance that the reaction will resolve. D. Administer an antihistamine without confirming the allergy. Answer: A. Discontinue the medication and notify the physician immediately. Rationale: the nurse must discontinue the medication immediately and notify the physician to prevent further complications from the allergic reaction. Documenting the reaction or administering an antihistamine without proper consultation is not safe. 38. In assessing a diabetic patient with an elevated blood glucose level, what should the nurse prioritize? A. Administering insulin and monitoring blood glucose levels. B. Asking the patient about their diet and exercise habits. C. Notifying the physician about the elevated glucose. D. Offering the patient extra fluids to dilute the blood glucose. Answer: A. Administering insulin and monitoring blood glucose levels. Rationale: administering insulin and monitoring blood glucose levels are essential to managing elevated glucose and preventing complications. Other actions can follow, but addressing the immediate concern is a priority. 39. What is the nurse's responsibility when caring for a patient in the post-anesthesia care unit, PACU, with a low oxygen saturation level? A. Reassuring the patient that the oxygen saturation will improve on its own. B. Administering oxygen and monitoring oxygen saturation. C. Ignoring the low oxygen saturation if the patient is stable. D. Increasing the dosage of pain medication to improve comfort. Answer: B. Administering oxygen and monitoring oxygen saturation. Rationale: administering oxygen and monitoring the patient's oxygen saturation levels are crucial to preventing complications post-surgery. Reassurance or medication adjustments without addressing the oxygen level would be unsafe. 40. What is the first action a nurse should take when caring for a patient with a suspected stroke? A. Administering aspirin immediately. B. Ensuring the patient is positioned with their head elevated. C. Notifying the physician and preparing for possible intervention. D. Taking the patient's blood pressure to assess the severity of the stroke. Answer: C. Notifying the physician and preparing for possible intervention. Rationale: early notification of the physician and preparation for further interventions are essential in stroke care. Managing the patient's position or blood pressure should follow, but immediate action to secure care is priority. 41. When assessing a patient with a suspected pulmonary embolism, what is the nurse's priority action? A. Administering pain medication as ordered. B. Performing a thorough respiratory assessment. C. Encouraging the patient to ambulate to reduce clot formation. D. Waiting for diagnostic tests to confirm the diagnosis. Answer: B. Performing a thorough respiratory assessment. Rationale: a thorough respiratory assessment is critical for detecting signs of pulmonary embolism such as shortness of breath, tachypnea, or hypoxia. Administering pain medication may be needed later, but the focus is on assessment. 42. In a patient who is admitted with a high fever and suspected infection, what should the nurse do first? A. Administer antipyretic medication as prescribed. B. Collect blood cultures and notify the physician. C. Take a detailed history of the patient's travel and exposure. D. Offer fluids to help reduce the fever. Answer: B. Collect blood cultures and notify the physician. Rationale: the nurse should collect blood cultures before administering antibiotics to identify the organism causing the infection. Prompt physician notification allows for timely management. 43. When caring for a patient with congestive heart failure, CHF, and shortness of breath, what should the nurse do first? A. Administer diuretics as prescribed. B. Elevate the patient's head to help with breathing. C. Monitor the patient's blood pressure and pulse. D. Assess the patient's respiratory rate and oxygen saturation. Answer: D. Assess the patient's respiratory rate and oxygen saturation. Rationale: assessing the patient's respiratory rate and oxygen saturation will help determine the severity of the shortness of breath and guide appropriate interventions, such as oxygen therapy or diuretic administration. 44. A patient is experiencing chest pain. What should the nurse do first? A. Administer pain medications as ordered. B. Obtain an electrocardiogram (ECG). C. Notify the physician and await instructions. D. Reassure the patient that the pain will subside. Answer. B. Obtain an electrocardiogram (ECG). Rationale. Obtaining an ECG is critical to diagnosing the cause of chest pain, particularly to rule out a myocardial infarction or other cardiac event. Pain management follows after initial assessment. 45. In caring for a patient with hypovolemic shock, what is the nurse's immediate priority? A. Administering oxygen to improve tissue oxygenation. B. Infusing intravenous fluids to restore blood volume. C. Monitoring the patient's vital signs. D. Assessing the patient's pain level and comfort. Answer. B. Infusing intravenous fluids to restore blood volume. Rationale. Restoring blood volume with 4 fluids is the priority in hypovolemic shock to increase perfusion and stabilize the patient. Oxygen administration and monitoring follow once circulation is addressed. 46. In a patient with an allergy to latex, which action is the nurse's priority? A. Administering the prescribed antihistamine medication. B. Removing all latex products from the patient's room. C. Notifying the physician of the allergy. D. Reassuring the patient that the allergy is not severe. Answer. B. Removing all latex products from the patient's room. Rationale. The first step in preventing an allergic reaction is to remove all latex-containing products from the room, as this reduces exposure and potential for a reaction. 47. A patient with COPD is experiencing increased shortness of breath. What is the nurse's first action? A. Administer a bronchodilator as ordered. B. Provide supplemental oxygen and monitor saturation. C. Call the physician for further orders. D. Reassure the patient that the symptoms will pass. Answer. B. Provide supplemental oxygen and monitor saturation. Rationale. Administering oxygen and monitoring the patient's oxygen saturation is essential to managing an acute exacerbation of COPD. Bronchodilators and other interventions follow after oxygenation is addressed. 48. A patient who recently underwent surgery shows signs of wound infection. What should the nurse do first? A. Clean the wound with an antiseptic solution. B. Administer antibiotics as prescribed. C. Notify the physician and document the findings. D. Reassure the patient that the infection will resolve on its own. Answer. C. Notify the physician and document the findings. Rationale. Promptly notifying the physician is necessary to guide further treatment. The nurse should also document the findings accurately. Wound care and antibiotics follow after the physician is notified. 49. When managing a patient with a suspected stroke, what is the nurse's priority? A. Administering tissue plasminogen activator, TPA. B. Assessing the patient's neurological status. C. Providing fluids to ensure hydration. D. Preparing the patient for surgery. Answer. B. Assessing the patient's neurological status. Rationale. A thorough neurological assessment helps identify the type and severity of the stroke, which guides the immediate course of treatment, such as thrombolytics or surgery. 50. In a patient with diabetes and poor circulation, what should the nurse do first when the patient complains of pain in the lower extremities? A. Administer pain relief medication as ordered. B. Assess the patient's circulation and vital signs. C. Provide warmth to the affected area. D. Elevate the legs to improve blood flow. Answer. B. Assess the patient's circulation and vital signs. Rationale. Assessing circulation and vital signs is essential to determine the cause of the pain and guide appropriate interventions, such as further vascular evaluation or pain management. 51. A patient in the ICU is showing signs of sepsis. What is the nurse's immediate priority? A. Administering 4 fluids and vasopressors as prescribed. B. Taking blood cultures and administering antibiotics. C. Providing comfort measures and reassurances. D. Monitoring urine output and vital signs. Answer. B. Taking blood cultures and administering antibiotics. Rationale. Early identification and treatment of sepsis with blood cultures and antibiotics is essential to prevent deterioration. for fluids and vasopressors follow to manage septic shock. 52. When caring for a patient with a history of seizures, what should the nurse do first during a seizure episode? A. Administer anticonvulsants as prescribed. B. Place the patient in a side-lying position to maintain airway. C. Hold the patient down to prevent injury. D. Document the duration and characteristics of the seizure. Answer. B. Place the patient in a side-lying position to maintain airway. Rationale. The priority during a seizure is to protect the patient's airway and prevent aspiration by positioning the patient safely. Administering anticonvulsants and documenting the seizure can occur after ensuring safety. 53. A postoperative patient is experiencing nausea and vomiting. What should the nurse do first? A. Administer antiemetics as prescribed. B. Reassure the patient that nausea is common after surgery. C. Assess the patient's hydration status and monitor for signs of dehydration. D. Notify the physician immediately. Answer. C. Assess the patient's hydration status and monitor for signs of dehydration. Rationale. The nurse should assess hydration status to prevent complications like dehydration or electrolyte imbalances. Anti-nausea medication may be administered after the assessment. 54. What is the nurse's priority when caring for a patient with a known history of falls? A. Encouraging independence in daily activities. B. Implementing fall precautions to minimize risk. C. Notifying the physician about the fall risk. D. Documenting the patient's fall risk in the medical record. Answer. B. Implementing fall precautions to minimize risk. Rationale. Fall precautions, such as using non-slip socks, ensuring the patient has a call bell, and keeping the environment safe, are vital in minimizing fall risk. 55. In a patient with dehydration and tachycardia, what should the nurse do first? A. Administer intravenous fluids to restore hydration. B. Reassure the patient and encourage oral hydration. C. Monitor the patient's vital signs regularly. D. Administer medications to control the tachycardia. Answer. A. Administer intravenous fluids to restore hydration. Rationale. For fluids are crucial in treating dehydration and improving circulation, which may help normalize the heart rate. Reassurance and oral hydration are secondary to addressing the fluid deficit. 56. A patient is recovering from an appendectomy and shows signs of abdominal distension. What should the nurse do first? A. Notify the physician immediately. B. Reassure the patient that this is a normal postoperative finding. C. Assess the patient's bowel sounds and abdominal girth. D. Administer pain medication as ordered. Answer. C. Assess the patient's bowel sounds and abdominal girth. Rationale. Assessment of bowel sounds and abdominal girth is critical to determining the cause of distension, such as ileus or complications, and informs further action. 57. A patient is complaining of severe headache and blurry vision. What should the nurse do first? A. Administer pain medications as prescribed. B. Assess the patient's blood pressure. C. Notify the physician about the symptoms. D. Offer fluids to relieve symptoms. Answer. B. Assess the patient's blood pressure. Rationale. Severe headache and blurry vision can be signs of hypertension or preeclampsia, so assessing blood pressure is essential to ruling out these conditions. 58. What is the first priority when caring for a patient with a large open wound and severe bleeding? A. Applying a sterile dressing to the wound. B. Elevating the legs to improve circulation. C. Applying direct pressure to control bleeding. D. Notifying the physician and preparing for surgery. Answer. C. Applying direct pressure to control bleeding. Rationale. Direct pressure is the most effective way to control severe bleeding, preventing further blood loss while awaiting additional interventions. 59. When assessing a patient with a suspected MI, which finding is most concerning? A. Chest pain radiating to the left arm. B. Bradycardia and hypotension. C. Diaphoresis and nausea. D. Decreased lung sounds and coughing. Answer. B. Bradycardia and hypotension. Rationale. Bradycardia and hypotension in the context of an MI indicate possible cardiogenic shock, which is a life-threatening complication and requires immediate intervention. 60. When caring for a patient post-transplant, What is the nurse's priority? A. Monitoring for signs of graft rejection. B. Administering immunosuppressive medications as prescribed. C. Encouraging the patient to ambulate. D. Documenting the patient's recovery progress. Answer: A. Monitoring for signs of graft rejection. Rationale: early detection of graft rejection is critical in transplant care as it can significantly affect the outcome. Immunosuppressive medications are part of the plan, but do not replace vigilant monitoring. 61. What is the nurse's priority action for a patient who has just received a blood transfusion and is showing signs of an allergic reaction? A. Stop the transfusion and administer antihistamines. B. Monitor the patient's vital signs and continue the transfusion. C. Administer oxygen to the patient and reassess. D. Notify the physician and prepare for further interventions. Answer: A. Stop the transfusion and administer antihistamines. Rationale: the nurse should immediately stop the transfusion if an allergic reaction is suspected to prevent further complications and administer antihistamines as ordered. 62. A patient with a history of chronic kidney disease is experiencing decreased urine output. What is the nurse's priority action? A. Administer diuretics as ordered. B. Assess the patient's fluid status and monitor vital signs. C. Encourage increased fluid intake. D. Notify the physician of the decreased output. Answer: B. Assess the patient's fluid status and monitor vital signs. Rationale: the nurse must assess the fluid status, monitor vital signs, and look for signs of fluid overload or dehydration, which may guide further actions. 63. A post-surgical patient is experiencing a sudden drop in blood pressure and increased heart rate. What should the nurse do first? A. Administer fluids to restore blood volume. B. Assess the surgical site for bleeding. C. Administer blood pressure medication as ordered. D. Notify the physician immediately. Answer: B. Assess the surgical site for bleeding. Rationale: the nurse should first assess for possible internal bleeding at the surgical site, which may be causing the sudden drop in blood pressure and increased heart rate. 64. When caring for a patient with asthma who is experiencing an acute exacerbation, what should the nurse do first? A. Administer bronchodilators as prescribed. B. Check oxygen saturation levels and provide oxygen if needed. C. Reassure the patient that the symptoms will resolve. D. Position the patient in a supine position for comfort. Answer: B. Check oxygen saturation levels and provide oxygen if needed. Rationale: checking oxygen saturation and providing oxygen as needed is the first priority in managing acute asthma exacerbation to ensure adequate oxygenation before administering bronchodilators. 65. In a patient with an elevated potassium level, which action is the nurse's priority? A. Administer potassium-lowering medications. B. Monitor the patient's cardiac rhythm and vital signs. C. Encourage increased fluid intake. D. Notify the physician immediately. Answer: B. Monitor the patient's cardiac rhythm and vital signs. Rationale: hyperkalemia can cause life-threatening arrhythmias, so monitoring the cardiac rhythm and vital signs is the priority to detect early signs of complications. 66. A patient with diabetes is experiencing hypoglycemia. What is the nurse's priority action? A. Administer insulin as prescribed. B. Offer the patient a fast-acting carbohydrate. C. Reassure the patient that the symptoms will resolve. D. Monitor the patient's blood glucose level again in 15 minutes. Answer: B. Offer the patient a fast-acting carbohydrate. Rationale: the priority in hypoglycemia is to provide a fast-acting carbohydrate to raise the blood glucose level. Insulin administration is not appropriate in this case. 67. When caring for a patient receiving total parenteral nutrition, TPN, which of the following is a priority assessment for the nurse? A. Assessing the patient's blood glucose levels regularly. B. Monitoring the patient's bowel sounds and abdominal distension. C. Checking the TPN infusion site for redness and swelling. D. Assessing the patient's weight and hydration status. Answer: A. Assessing the patient's blood glucose levels regularly. Rationale: TPN can cause fluctuations in blood glucose, so regular monitoring is crucial to prevent hyperglycemia or hypoglycemia. 68. A patient who has had a stroke is exhibiting signs of dysphagia. What should the nurse do first? A. Administer the prescribed medications by mouth. B. Place the patient on a soft diet and thicken liquids. C. Notify the speech therapist for a swallowing evaluation. D. Encourage the patient to eat and drink slowly. Answer. C. Notify the speech therapist for a swallowing evaluation. Rationale. A swallowing evaluation by a speech therapist is necessary to assess the patient's ability to safely swallow and prevent aspiration. 69. When caring for a patient with a history of substance abuse, what should be the nurse's priority? A. Reassuring the patient that their addiction can be easily treated. B. Monitor for withdrawal symptoms and administer medications as ordered. C. Encourage the patient to engage in social activities. D. Administer pain medication as prescribed. Answer. B. Monitor for withdrawal symptoms and administer medications as ordered. Rationale. Withdrawal symptoms can be life-threatening, so monitoring for signs of withdrawal and administering medications to manage them is the priority. 70. A patient is receiving a blood transfusion and begins to experience chills and fever. What should the nurse do first? A. Administer antipyretic medication as prescribed. B. Stop the transfusion and notify the physician. C. Document the symptoms and continue the transfusion. D. Increase the rate of the transfusion to compensate for the symptoms. Answer. B. Stop the transfusion and notify the physician. Rationale. Chills and fever can be signs of a transfusion reaction, and the nurse should stop the transfusion immediately and notify the physician for further action. 71. A patient with congestive heart failure, CHF, is showing signs of acute respiratory distress. What is the nurse's first priority? A. Administer oxygen and monitor the patient's oxygen saturation. B. Encourage the patient to cough and deep breathe. C. Administer diuretics as ordered to reduce fluid retention. D. Reassure the patient that the symptoms will resolve on their own. Answer. A. Administer oxygen and monitor the patient's oxygen saturation. Rationale. Providing oxygen and monitoring oxygen saturation is the priority in acute respiratory distress to prevent hypoxia and support gas exchange. 72. A patient who has been receiving chemotherapy is at risk for infection. What should the nurse do first? A. Administer the prescribed antibiotics. B. Place the patient in isolation to reduce exposure. C. Monitor the patient's vital signs and temperature. D. Encourage the patient to eat a nutritious diet. Answer. C. Monitor the patient's vital signs and temperature. Rationale. Monitoring for signs of infection, such as fever and changes in vital signs, is the priority to detect and address infection early. 73. A patient with a history of hypertension is admitted with a severe headache and blurred vision. What should the nurse do first? A. Administer pain medication as prescribed. B. Assess the patient's blood pressure. C. Reassure the patient that the symptoms will resolve. D. Notify the physician immediately. Answer. B. Assess the patient's blood pressure. Rationale. Headache and blurred vision can be symptoms of hypertensive crisis. The nurse should assess the blood pressure first to determine the severity of the condition. 74. A patient who has had a recent stroke is showing signs of dysphagia. What should the nurse do first? A. Encourage the patient to swallow thicken liquids. B. Contact the speech therapist for swallowing evaluation. C. Administer medications via the enteral feeding tube. D. Offer the patient small sips of water. Answer. B. Contact the speech therapist for a swallowing evaluation. Rationale. The nurse should ensure the patient's ability to safely swallow before offering oral fluids or medications. A speech therapist is essential for the evaluation. 75. When caring for a patient with acute pancreatitis, what is the nurse's priority action? A. Administer pain medication as ordered. B. Monitor the patient's blood sugar levels closely. C. Provide oral hydration and nutrition. D. Assess for signs of shock or organ failure. Answer. D. Assess for signs of shock or organ failure. Rationale. Acute pancreatitis can lead to shock and organ failure, so it's essential to assess for these complications first. Pain management and other interventions follow. 76. A patient is receiving post-operative care following abdominal surgery and is showing signs of a bowel obstruction. What should the nurse do first? A. Administer pain relief medication as ordered. B. Notify the physician immediately. C. Assess bowel sounds and abdominal distension. D. Encourage the patient to ambulate. Answer. C. Assess bowel sounds and abdominal distension. Rationale. Assessing bowel sounds and abdominal distension helps determine the severity of the obstruction and guides further treatment. 77. A patient is receiving insulin therapy and is experiencing hypoglycemia. What is the nurse's first priority? A. Administer insulin as ordered. B. Offer the patient a fast-acting carbohydrate. C. Monitor the patient's blood glucose levels. D. Notify the physician of the hypoglycemic event. Answer. B. Offer the patient a fast-acting carbohydrate. Rationale. Providing a fast-acting carbohydrate is the priority in managing hypoglycemia to quickly raise the blood glucose level. 78. A patient with a history of asthma is experiencing wheezing and shortness of breath. What should the nurse do first? A. Administer a bronchodilator as prescribed. B. Administer oxygen to the patient. C. Reassure the patient and monitor their symptoms. D. Notify the physician immediately. Answer. A. Administer a bronchodilator as prescribed. Rationale. Administering a bronchodilator is the first action to relieve bronchoconstriction and improve the patient's breathing. 79. A patient has been diagnosed with pneumonia and is experiencing a fever, productive cough, and shortness of breath. What should the nurse do first? A. Administer antibiotics as prescribed. B. Encourage the patient to cough and deep breathe. C. Monitor the patient's vital signs and oxygen levels. D. Reassure the patient that the symptoms are normal. Answer. C. Monitor the patient's vital signs and oxygen levels. Rationale. The nurse should monitor vital signs and oxygen levels to assess the severity of pneumonia and guide further interventions. 80. A patient with a history of diabetes is showing signs of diabetic ketoacidosis, DKA. What should the nurse do first? A. Administer insulin as prescribed. B. Administer fluids and electrolytes as ordered. C. Monitor the patient's blood glucose and ketone levels. D. Notify the physician immediately. Answer. C. Monitor the patient's blood glucose and ketone levels. Rationale. Monitoring blood glucose and ketone levels is crucial to assess the severity of DKA and guide treatment.